After breast surgery, pain and some swelling are really common, just like they would be after another major surgery. Most of this pain and the swelling comes from an inflammatory response to the surgery itself, and that should really go down between 1 and 4 weeks later. However, for some, this pain can linger on for weeks to months or even years later, and that can become a major problem. However, there are some things that you can do to help reduce the swelling and the pain after breast surgery to help speed up recovery, but also address the long-term side effects. My name is Kelly. I'm a physical therapist. I specialize in cancer and lymphedema, and in today's video, I'm going to explain and go through these different ways to help reduce swelling and pain after breast surgery. For more topics on cancer and swelling, be sure to subscribe down below, and you can follow along with us on Instagram for more related content. Right away after surgery, it is likely that your surgeon is going to encourage you to relax and take it easy, and you do want to follow these directions. For the first 10 days up to 2 to 3 weeks, you want to take it easy and rest and recover. Doing too much too soon can add to the pain and add to the swelling. For a lot of people, they like to get a recliner so that they can be propped up and comfortably supported with a lot of pillows to help decrease pressure on the area or the chest. Another area to look at is what type of clothing someone is wearing. Something that is really tight and restrictive can add to the pain and the swelling. One of the most popular items to get is a proper bra. So right away after surgery, a lot of times people will not put any pressure, but if you do, you want something really light and soft. One of the most popular brands out there is 𝐏𝐿𝐿, and they create bras specific to those after breast surgery or going through breast cancer treatment. They break down their website for options for after radiation and for each type of surgery, such as a lumpectomy section versus a mastectomy section. And so they have a lot of different types of bras that are really soft in fabric. A lot of them clasp and open in the front to make it easier to get on and off. And they do have removable paddings that the bra will then lay flat for someone who has a mastectomy, or if they have a one-sided or unilateral, you can have a cup in one and not in the other. So just a lot of variations. This one does clasp in the back, but they have other ones in the front, like this one as well. And so I will place links down below for some of the most popular 𝐏𝐿𝐿 bras and their website that you can check out further. Now, if someone has a lot of swelling after surgery, that can also be really painful. Now, for the first 10 days, 2 weeks or so, a lot of that swelling is uncomfortable, but if we put a lot of pressure, it's just too sore because of the surgery. And so we'll still use the nice and gentle 𝐏𝐿𝐿 bras. If someone has swelling that lingers on a long time, or they've had it, for months or years and it's lymphedema, we will look at getting a true compression bra, such as this one from Prairie Wear. Compression bras give more support than a sports bra would, but it's still a comfortable amount of compression. They'll have no underwire. They'll also open and close in the front to make it easier to get on and off, but they give enough support to help gently put pressure on the area, and that will reduce swelling, which will then reduce pain. So working with your certified lymphedema therapist or the vendors, they can help fit you for the right size of a compression bra. If someone has more severe swelling or fibrosis, which is just thickening of the tissue from swelling, we may look at getting someone a Swell Spot. This is just one option, just one of the kidney size. This will, it's kind of like a small pillow we'll put in the compression bras, and that'll give more support to the area, and that can help soften the tissue. And again, all of that can help decrease the swelling and then decrease the pain. Again, within the first week or two after surgery, a lot of the doctors will say, do not do too much. And many will say, don't lift your arms above your shoulder height or your head height, because if you still have your drains in, we don't want to risk pulling them out, as well as you're at an increased risk for a seroma, which is a pocket of fluid in an area, if you do too much movement too soon. But after that time, once someone is clear, we want to start doing gentle stretches and gentle range of motion exercises to decrease the tightness, which can cause pain, and also to get some blood flow and get some of that swelling moving again. So I always start with gentle stretches because that is one of the easiest ways to help decrease someone's tightness pain. And I have made another video on my favorite stretches after breast surgery, which I will link up above, someone can check out. But working with your cancer rehab physical therapist, they can create you a gentle program specifically for where you are tight, and that can help decrease pain a little bit quicker and recover. Once someone has gone through the stretches and are starting to feel good and getting their range of motion back, that pain may have gone down. It's also good to look at strengthening exercises and aerobic exercise. Exercise plays a major role in pumping the fluid throughout the body, but also keeping the tissues really healthy. And so what someone tolerates, the stretches and movements, we do look into adding weights, adding strength exercises, and then also adding any aerobic exercise that someone enjoys doing, whether it's bicycling, walking, running. Again, once cleared, all of these things are great to do. I'm a big advocate of finding something that someone enjoys doing, getting back into hobbies that they love to do, because whatever it is that they love to do, they're more likely to be more consistent with, and that's the most important part. Again, I have created a couple videos on basic strength exercises that we start with after breast surgery, so I will link those up above or down below as well. Now, some people come into the clinic and they have what we call post-mastectomy pain syndrome, and they are just very hypersensitive to touch. So someone will even come in holding their shirts away from their chest because it's just sensitive for the fabric of the clothing to touch the skin. What we do with that situation is we start desensitization, which means we're trying to calm down the nerves that are causing the pain. Nerves cause a burning, tingling, just sharp sensation, again, that hypersensitivity, and we need to calm them down by doing light touch. So they are sensory nerves, so they, react to touch. What we need to do is start to gently touch that area, maybe use lotion and massage that in, anything to start to re-regulate or re-control those nerves. That can over time help decrease their sensitivity level, and that can also help decrease the pain from there. Another reason for pain may be due to axillary web syndrome or axillary cording, which is where a lymphatic vessel gets bound down, usually around the scar tissue or the scars, and that can get bound down and pull, and it can even run all the way down towards the wrist in a severe situation. That will cause limitations with movement, and that can be really painful with that restriction. And so what we do is different stretches, different mobilizations. A therapist may do massage-like techniques to release that cord, and then someone can get their motion back and then decrease their pain. I have made another video on axillary cording and the different treatment options we use for it, and I will link that one up above and down below as well. So again, pain is likely present right after surgery, at least for the first week or two, and then hopefully should decrease from there. But for some, it does linger on a longer amount of time, for weeks, months, or years later, and that's when we want to step in and make sure that we're contacting your doctor or your provider to get some sort of pain management control. A lot of these things we talked about today may be beneficial, but other options may be pain medications or prescriptions from the doctor, acupuncture, massage, or other types of therapies. If you are watching this and you have pain, the next step would be to reach out to your doctor or a medical provider to help look and address your pain specifically, as every person has his, her, or their own personal needs. I hope you all found this video helpful. Again, feel free to subscribe down below for more related content, and I will see you all next week for another video. Thanks, everyone.